So I asked Erin to come and speak for us from New Zealand. I realized as I keep talking or keep introducing people that I've got people from all over the world here. And I asked her specifically to come because I met Erin 6 months ago, in February, yeah, and was just intrigued by what she's doing over in New Zealand. And I was like, we need you. I need you to do some presentations so that, you know, we can take this further in this country. She's taught at the South Pacific College of Natural Medicine for almost 2 decades in New Zealand. She's got about over 25 years of clinical and massage experience and has specialized in work with pregnant, sort of from the beginning of conception through to after birth and infant feeding experience. And she's a fierce protector of the microbiome. And in 2014, which is the research that the piece that I'm really intrigued by, she created a 6-hour community course called Authentic Resistance. And it encompasses informed consent, vaccine history, vaccine components, and the models of health. And it's focused on basically reducing fear and understanding these childhood illnesses and really making sure that people understand that if you get measles, mumps, rubella, chickenpox, you know, those diseases, that you're not going to die from them. You know, there's a good way you can actually live through them and boost your immune system through them. And she's also, when the Vax team came to New Zealand just in the last few months, she was one of the people that organized that. And so I'm honored to have Erin here. She's giving this talk, and then she's got a talk later on chickenpox and bring your own shingles. And I really think this, to me, is a core, as I introduced Myra, that to me, understanding these childhood diseases and not being afraid of them, because we are, as parents, we're made deathly afraid. And I say deathly seriously because the pediatricians will tell you that your child will die from these diseases. And we, you know, anyone who's older than sort of 40 knows and probably has had all of these diseases and didn't think twice about it. So I'm really honored to have Erin here and can't wait to hear what she has to share with us. Thank you.
So thank you for inviting me, Christina. And I'll just tell you very quickly about what authentic resistance means, because my colleague and I both have 2 different definitions. So my definition is, when you say no to something, you need to say no and mean it, but you also need to know why you're saying no. Because if you say it from a place of, I'm saying no, but I actually don't know why, then it's very, very easy to be that hesitant parent who's then talked into something else. My colleague, she's an ex-vaccinator. So her job was corporate flu vaccines. And I caught her in a very vulnerable moment of being unsure about the job she was doing, because like me, she'd worked with lots of parents, and she had a real problem when she had to start vaccinating pregnant women. So in that vulnerable moment, as I listened to her, I said, I've had a course percolating for about 25 years, and I think you would be the perfect person to do it with me. So her definition of authentic resistance is that your body has the ability, if a germ, a pathogen, a microbe gets into you, to actually authentically resist it with the immune system that it has. So the 2 of us together, we've been running this course for nearly 2.5 years. And as Christina said, the main takeaway that people have is it reduces their fear. And that's including the dads who come to the workshop who've been sent because their partner at home, she already knows that she's not going to be vaccinating the children, but he may be unsure because he wants the facts. So when the dads come and when the couples come together, their main thing is that they meet all these people who also are choosing the same model of health as them, so they don't feel quite such a strange person. But they also get a sense of it's not as scary as everybody made it out to be. So that's the definition of our course. So kia ora tātou, which in Māori is greetings. Greetings to you all from the land of the long white cloud. And I'm really relieved to know that they're not chemtrails. So my day job, like Christina says, I've been teaching at the South Pacific College of Natural Medicine for about 2 decades, and the college itself has been teaching for 50 years. We've just had our jubilee. So we're at the forefront in New Zealand with our natural medicine education, and the students, when they come to study with us, when they complete, they have a degree in natural medicine. There's a saying, what floats my boat? Hopefully it transfers over to here. But it's what gets me up in the morning to be really excited about teaching without having any thought about whether or not this is actually going to make me any money or get me any further with what I want to be doing. But what it gives me is a chance to work with families at that grassroots level and giving them confidence and also giving them choice. I've got a wee picture up there of a previous occupation, because I'll come to that at the very, very end of the presentation. But as well as being a volunteer firefighter, I've worked in hospitals, I've been a nurse, I've worked with families as childbirth educator, I lecture at the moment at the college. And for about 18 to 20 years of that time, I worked as a naturopathic family physician with lots and lots of families. So I think my eldest client that I've seen recently is about 26, 27, and I remember seeing him as a colicky 3-month-old. So it's a lovely part of the practice to see these children have become adults and now becoming parents themselves. So this is the essence of the talk. This morning we're going to look firstly at models of health and then basic nursing cares. And it's really basic nursing cares. It's those things that we used to ask our neighbour, our mother, our grandmother, our sister and our extended family. And now that families have no neighbours because everyone's gone to work and perhaps like some mothers, you know, they're busy grandmothers doing other things. So that chance to just check in with other people who've had these experiences is not quite so able to us. So we turn to Dr. Google. And of course, Dr. Google is one really good way to get really fearful. In fact, I think hypochondria is probably stemming from watching and reading and looking at too much Dr. Google. I'm going to talk a bit about human milk because it's a very, very big part of the puzzle with regarding immunity, and it's one that's kind of overlooked. It's like, yeah, breastfeeding, and we don't call it nursing in New Zealand. Nursing is what nurses do. We call it breastfeeding because that's what it is. And then finally, the measles, mumps and rubella part we'll get to halfway through, and there's some real take-home points there for families who have got any of those diseases or options coming up. So when babies are born, their immune system is perfect. It's non-reactive, which means everyone who kisses them, everyone who touches them, everyone who wants to have a cuddle is not necessarily going to pass on too much in the way of germs. The way that their immune system has been set up for birth is to be very non-reactive, and breast milk actually keeps their body non-reactive. And so that's one of the really first keys to not introducing any other feeding method whatsoever. So whether it be complementary, whether it be artificial, or whether it be solids too early, all of those foods and extra foods on top of breast milk can actually start to stimulate the child's immune system and start having it be reactive, which is what you don't want it to do very, very early on. And I love the part there about it's populated by its father's breath, because what do you do when you look at a new baby? You just go, oh, you know. So all of that wonder that we have when our child arrives, all the kissing and the breathing and the looking is part of just getting their immune system used to us gently without being overwhelmed. With a child who has had no medication, intervention whatsoever, it's very unlikely that that child then needs to go on to have further medical or further even other types of remedies in the way of help. And it's kind of interesting because some of the families that I've worked with have never ever seen a doctor. So they're 8, 9, 10, maybe 12 years of age, possibly, and they've never been to see a doctor because they've either been treated at home with their family or they've used their homeopathic remedies and their Bach flower remedies, and they simply have no idea what going to the doctor means. The medical model of health, it tells us that even before the baby arrives, it needs fixing. So mothers who are encouraged to have a vaccine in their pregnancy, they're already given the message that you're not quite ready for this baby, your body isn't going to be able to help this baby, so we're going to have to start injecting you early so that you can be prepared to look after your baby when it arrives. If more effort was put at that point into looking at what human milk does, I'm sure that some of the fear, in fact a great deal of the fear, would be diminished quite early on. Little babies, when they're born, even before that first hour is done, even in New Zealand, they're offered the synthetic vitamin K, which, if you want to look at that a little bit further, is for often the reasons are not necessary. And in the medical model of health, there's this assumption that medication's fine for babies. Most of them suit it and come through really easily, and most of them have the benefits of it. So there's that sort of dichotomy there of what we have, the physiological one, and then we have the medical one. So at this point, I want you to just turn around and look at someone or be right next to someone and have a quick 2-minute chat, just 2 minutes, about the medical model of health and the physiological model of health and where you see your model within those two. Okay. Let's just bring you back, my practice with animations. So I'm sure in that conversation that you had, you realised that you could talk about that for about 25 minutes just with that one person. Because if you're here today, you're interested in health and you're interested in models. But I'm curious as to whether fear came up in any of the conversation that you very, very quickly had. Because quite often fear, it sits there, it's behind us, it's on our shoulder, but we try and logically think about what is our medical model without addressing the fact that our medical model is probably, our health model is quite likely affected by that fear factor as well. And what happens when you live in a constant state of fight or flight is that you get anxious, you get nervous, and it's a really difficult place to be in if you're trying to make a decision, especially trying to make a decision about your child's health, and especially when they're already unwell. So, how do we recognize fear? And when we recognize fear, it's always useful to find out where in our own body it sits. So it might be that it comes into our head as a thought, but it also might immediately go to our belly, or it could sit in our chest, or it can just be in our shoulders. And it's quite useful when you do have that immediate feeling of fear come upon you to, instead of being overwhelmed by it, to just notice where it is. So if it's in the chest, it's about breathing. If it's in the belly, it's about just breathing in to the belly. If it's about the shoulders, it's about moving those shoulders back. But it's identifying that it's real and it's in you, but it doesn't have to overpower you, especially if you're trying to make a decision. So how do you harness fear? I think after I had my first child, I have 3, I read this book and I loved the title and I loved the book by the end of it. So if you hadn't read it, Suzanne mentioned Robert Mendelsohn yesterday in her talk at the end of the day. He wrote this book called How to Raise a Healthy Child in Spite of Your Doctor. And the fact that he was a paediatrician and he had a sense of humour and he actually really, really encouraged the reader to think to themselves, you know, you don't have to take your child to the doctor for every single little thing. In fact, I think he said something like 95% of the children that came to his surgery did not need to be there. He really only needed to deal with that small percentage who needed a general practitioner, doctor's care, but he most likely wrote the book so that families could do some of that parenting, some of that health healing at home without having to actually burden the doctor, but also to burden themselves with the appointment and taking the sick child in, and then the sick children in the surgery. And his preference was that people started to educate themselves at home. So I very much encourage young new families, if they have still got a really big fear, that they need to get some reading so that they can at least relax around that part. How to coexist with fear, because even if you've read all the books, and even if you've done all the breathing, and even if you've learnt all the facts, you're still going to have that unhappy relationship with fear, which will settle in, from time to time. So we encourage families, once they start along this journey, to be loud and proud. And for some people, it's talking to their family about their vaccine choices, or about why they're choosing to not use paracetamol, and why they're choosing to use other modalities. But we also find that people really like to find their tribe, or get in touch with other people who think like they do. And if you haven't heard yet of My Incredible Opinion, anybody? So the thing about Forrest Meredi and My Incredible Opinion is that he's funny. And I find that when you laugh, quite a lot of that fear dissipates. It's like it has to. And the other reason I like Forrest is I've met him, and he's a dad. He's a dad who just likes to share what he knows, and he has a spare room, a green screen behind him, and he just talks about something for 3 or 4 minutes, and he generally does mock the CDC and the WHO, he calls them that. And it's a great way for dads especially, who have been sent along to the course, or who've been, made to read the books, or forced to, be involved with this really important decision. It means that they can watch a bloke, they can watch a dad, they can learn something, and they can have a laugh at the same time. So really encouraged to look. He's at almost 100 clips at the moment. So what I want to ask now is who's had measles? Okay, who's had mumps? Wonderful. And who's had rubella? Who knows? It's such an easy disease. In fact, it's hardly got any slides at all. But it's quite common that people have had measles, mumps and rubella, depending on their age group. And not many have got bad memories. There might be some spots or some discomfort. But quite often for families, when they've got a child who's going through a 3, 4, 5, 6 day type disease symptom picture, is that there's a lot of learning and growth, not only for the family, but particularly for that child. It's like, I got through that. I made it to the other end. And also the feeling of having that tick for the mum, like tick measles, tick mumps, knowing that they've moved through that phase or that milestone of their life, and now they can, either look forward to better health because of it, and we know with measles, and we know with some other diseases there's those benefits. But the nice thing is that you get to see that, you can accomplish these diseases very easily without having to resort to medical intervention. So the model of health that I ascribe to is the watch, wait, and see. And when I had my first child, I didn't. Anything that happened, I was quickly in with the remedies, and quickly in with a rescue remedy, and quickly in with anything that I could think of to alleviate any discomfort or pain. And it wasn't until I had more children and got more confidence that I started to watch, wait and see. And I based this on Hippocrates, which he says, that observation of clinical signs, rational conclusions, that's without fear, does not rely on religious or magical beliefs. So with watch, wait and see, in that watch phase, what you're doing is you're just being your normal family. You're watching the children, you're seeing that they're growing well, you're supporting them with really great food, whatever it is, wherever you can source it. They get to sleep well, sleep all night in their own bed if that's where they stay, and they get to laugh often. And as you're watching, you invest. So you invest in some good supplementation or modalities or remedies, but it has to be good product. Quite often our families will go to the supermarket and they'll get some vitamins and minerals, and they'll say they didn't work very well. And so we'll say, no, you need to go to a reputable, good stockist and get something which is actually going to have some oomph. Now, it might cost a bit more, but that's why the word invest is there, because you're investing in your child's health. Investing in experienced practitioners, and I started to list these, and then I thought if I miss someone out, I'll be in trouble. So any practitioner that attunes to you with your intuition around what it is that you need from that practitioner, that's the one for you. And I find some people will see a homeopath, and then they'll see the osteopath, and then they might go to the chiropractor. And it's like, go to whatever you need to do, but make sure that you're getting some benefits and some accomplishment there, because again, it's costly, and again, it's an investment. Now, in the waiting phase, while you're waiting for these diseases or waiting for these milestones to be ticked off, it's quite important that conversations that we used to have with a neighbour are incorporated into our everyday social life. So when you've got those people that believe in the same things that you believe in, it's great to have those conversations with them, because we always can learn more from somebody else. I think also when you get to hear someone's experience, my child had this, I did this, they did this, I did this, and this is what happened, then it's a great way of building confidence for you, and it gives you a chance when you've completed your, perhaps, disease experience, that you can share that information with someone else. I think when you have things happen to the body, whether it's inside, outside, skin, bowels, chests, it's quite important to discuss those sorts of things with children so that they understand that you're going to get better and this is what your body's doing, because what it starts to do is create for them their own model of health. And we quite often have families who don't vaccinate, who haven't actually explored the model of health that they're bringing their children up with, so that by the time the child gets to be a teenager, a young adult, they might not have any basis or belief around why they haven't been vaccinated, why they choose this over that. And so being really, really clear in the beginning and open with the children about what it is that their immune system can do and what it is that their body can do allows them to actually learn and develop as well as go through these various diseases if they get them. Now, critically is to reduce or minimise fears, and often you'll have children who at some age will discover that actually all the people that they love are going to die sometime. And so that fear comes up quite early for children, and it's important as family, discusses anything to do with health, even family members' health, that they can reduce or minimise, because otherwise there's this, fatality about it. Am I going to die? It's like it's very unlikely. However, that will happen eventually for all of us. And the C part is that when something does happen, I really encourage families to write it down. And that's because in this day and age that if you're not vaccinating your children, but you do have measles, mumps and rubella, if you've got it documented, if you've got some photographs, if you actually go in to see your doctor and say, this is where we're at, I want you to document it in their notes. And it might also be that you get titers at some point from a blood sample, which then can go with their notes, so that when you do have an outbreak of something, but you haven't been vaccinated, you've got that documentation to show the school, if that's what happens here, to let them know, well, no, they're not vaccinated, but they have actually got antibodies to the disease that you're actually expecting them to go and stay home for. Also having a first aid remedy kit, and that's to do with, lots and lots of remedies, whether it's band-aids, bandages, as well as arnica and all those other remedies. And I think it's important too to write down when you clearly have had a major disease. So whether it's pneumonia or an ear infection that was quite severe, having it in a journal means that you've got it to look back with, especially with your doctor, so that if there's any concerns about your capabilities or whether you're being neglectful because you're choosing not to vaccinate, or even if it's just a matter of giving you the confidence to look back, so that you can see just how far that, you've come as a parent. A lot of these little booklets can be shared too with groups when people get together, so that you can see that there's a real chance of learning from what's been happening, instead of like, after 2 or 3 children, actually sometimes you can't remember what happened. When children have a little tiny cut and they go to bed And then they wake up the next morning and it's pretty much already fixed and you didn't even get a chance to put any cream on it. That's the thing to celebrate. Look how clever your body is. Look what it did all on its own without anything from anybody. And so it's instilling in them that actually it's able to manage itself if it's supported obviously with nutrition, hydration, connection, which is love, so that child has a chance for their immune system without any stress to heal well and to be effective. And I'm going to also reinforce nutrient-dense food education at this point. So it sounds a bit mean, but I do remember one child who was throwing up very unhappily. And after it was all over, we had a big conversation about jelly and how much jelly one person really should eat at one sitting. And in fact, like some other foods might have been a good option. So that's called a teaching moment. It's like no point talking about vegetables and good food options at the table when it's spread with all this food. The teaching moment is when something didn't go quite well because of a choice made by a small person and I think I'm going to keep away from that red jelly. So, how can I be so confident? How can I know if I'm telling you this, that this will be enough for a family instead of having to resort to that medical model? And the reason I'm confident is because that baby's immune system is actually not immature. It's not dormant. It's not just sort of waiting for things to happen. It's actually allowing human milk delicately, eloquently, all the nice words, to very, very gently unlock the immune system. So that by the time the baby gets to about 12 months of age, you start to have quite different reactions from an immune response than that child would have had at about 2 months of age. So human milk is actually the key to this. And if you haven't already watched Suzanne Humphrey's neonatal immunity series, there's parts 1 to 6, actually 1 to 6. It's a fantastic series. They're about 12 minutes each, which is bite-sized pieces. And it really focuses on the normal immune system, so that families can really see what the normal immune system does before they even consider doing anything else to it, including medications, including vaccines. So what's in human milk that makes it so special? Well, the most important thing is that it's been designed for a newborn human, a human being, not a cow, not a horse, not a sheep, not a rabbit. It's a human design, and the nutrients in it actually change as that baby changes. So we've heard about colostrum. That's that first 2 or 3 days. And colostrum not only works as a laxative to clear out the bowel with all the meconium that's been present for the last 2 or 3 months, but it also helps to get the immune system set and start it very, very gently reacting with that breast milk. It's also considered a blood product. So that's why when there's donations of milk, there's a real importance around making sure that that milk is okay to share. And we have milk banks in New Zealand, although they're pasteurised, but we do have a lot of milk sharing in New Zealand as well, and that's just through Facebook groups. Now, we have a blood test in pregnancy which clears people for HIV and hepatitis B, which means those families who are sharing milk have got that reassurance that they're not passing on any blood products or any blood-borne diseases. Now, it's very rare that a New Zealander will talk about an Australian. But this lady, her name's Maureen Minchin, and I haven't met her, but I have discovered her book about 3 or 4 months ago. It's actually 3 books in one, and this lady has been working with feeding for over 45 years, so a real stalwart in this area. Her first book talks about the milk hypothesis, and what she has found is that immune disorder can actually be communicated vertically, so compounding intergenerationally. So when we had in the 50s and the 60s women starting to have, use milk supplementation, they were having children that now are having children that will be having children. And so when you're using supplemented food that isn't human milk, you're actually generationally changing not only the DNA, but particularly the microbiome of each person that comes after. So as some families are now moving back to looking at human milk as a real thing to go for, we're actually slowly, hopefully, going to be reducing that immune and that allergy impact on future generations. The second book talks about the development of replacements for breast milk, and she has a huge history in the book. It's an amazing book, and it's going to be a great resource, I know, for me for the next couple of years. And she's a wonderful Australian. Now, human milk is so extraordinary that a study that was done in 2013 actually recommended that women didn't breastfeed after the rotavirus was given. And that's because they found out through the study that it actually neutralized the vaccine. So we call that kick ass. You know, if you've got a product which comes from the mother, which neutralizes that liquid, we have an oral, liquid rotavirus, that has to be good. So they weren't saying don't breastfeed. They're just saying wait a few hours before you breastfeed again because you don't want to neutralise that vaccine that you've just had. Which if I was a mum hearing that, I'd be thinking if I can nuke that vaccine, I think I could nuke just about everything else that comes near me. So it's a wonderful piece of research because it allows us to see the real delicacy behind breast milk, which has got such a huge effect on babies' guts. Some of you might know that human milk also can kill cancer cells. There's this called Hamlet, and it induces this death in tumour cells, but it leaves all the other cells around it completely unaffected. Now, it's quite interesting too, because what they say with this study is they say, we think we should explore this a little bit further as a novel approach to tumour therapy. And it's kind of sad that it has to be novel and like really surprising, and who would have thought, instead of like knowing how much benefit there is in human milk and studying human milk in the way that everyone can find out how amazing it is, so that we refer to that as our first medicine instead of just like, oh yeah, and breast milk might help too. But it's also very popular for families who are experiencing gut problems. And in our classes, this is anecdotal feedback. So this is from partners, from dads and from lovers. The ones that speak from that niche population of adults who've got access to human milk, probably more so than others in the community. And we've had dads who've had things like Campylobacter or Crohn's disease or quite uncomfortable tummy problems, with access to 20 or 30 mils, perhaps frozen, perhaps expressed, perhaps it was help yourself, milk that actually reduces the pain so dramatically that they have no use for any of their other medications. So it's really interesting because that means that as well as using it internally as a medicine for any person, it's also wonderful as a moisturiser for nipples, to helping with cracked nipples, for cleansers, for anything like an eye infection, a conjunctivitis or a sore ear. And topically as an antimicrobial, it works great for things like your measles and your chickenpox, vesicles and any skin problems, even eczema and asthma. You can use it internally as well. So human milk doesn't get nearly as much attention as it should. In fact, quite often when I bring it up, people are sort of like, oh yeah, I forgot about that. But actually that's the design. The design is the baby's born and everything that it requires is there, right ready for it, and it's there for a long time. So it's not just for little babies. It's not just for middle babies. It's just not for toddlers. It's that feeding relationship until both the people involved in that feeding relationship are ready to let it go. You have to have a breakup at some point. So, managing childhood illnesses and knowing that this is something that needs to be thought about, read about, ready for, so that when it arrives in your house, it's not the big shock that you might expect it to be. And I think the key is coming back to that watch, wait and see. Because for some problems, some issues, concerns, diseases, maladies, you actually don't need to do anything. And I think, again, with my first child, I was onto it. And as I realised that sometimes all I had to do was keep an eye on them, bathe them regularly so I can look for little cuts and what did you do there and how did that happen and that doesn't look right. Hydration is obviously hugely important, and I'll talk a lot about hydration. In fact, I'll keep talking about hydration because hydration is obviously for every part of their body, whether it's inside or out. It's kind of interesting when children do become unwell initially, they'll often crawl in for a cuddle and you think, this is not right, this is not my 3-year-old, that's not usually them. And part of coming in for a cuddle is if they're hot and you're not, and you have that skin-to-skin contact with them, then mum or dad's body, whoever the safe adult is, can actually help reduce their fever just by that skin-to-skin contact. You'll take on their heat and they will reduce the heat being near you. And it's interesting too because what happens at night when a child's unhappy or a bit unsettled or possibly a little bit hot is that they come sneaking into mum and dad's bed. And it's that seeking out of that reassurance which then allows that baby to go, oh, I'm with the people who love me. And in that relaxed state, their immune system will actually function better. So I guess the worst thing you can do for a little person who needs to be clingy is to keep putting them down, keep putting them somewhere else, because what they need is they need to be close. The fourth thing which is important, especially if you're worried and the fear has gotten the better of you, is to get a second opinion. Even if you're a very experienced parent with lots of experience in that disease, is to find out from somebody what they think. And it might be a doctor, but it might be your mum. It might be your sister, or it might be that lady down the road who's got 7 kids who knows more than anybody else. So with our watch, wait and see, we first of all have the big thing called fever. And a lot of people, I think, have something called fever phobia. The minute it arrives, they need to fix it and stop it and move it along. Whereas, in fact, the whole idea of having a fever is to allow the fever to do what it needs to do, supported with hydration, supported with someone keeping an eye, but also ensuring that the fever actually does what it needs to do in an amount of time that doesn't cause too much stress for the baby or the child and not too much stress for the family. Now, with most people, if they have any type of fever, they go straight for the meds and straight for the Panadol in New Zealand or the Tylenol in America. And what happens with these medications, that yes, they do take away some of the pain, and yes, they do reduce some of the heat, and yes, they allow the body to sweat. But in doing so, what can happen is that they allow the fever to actually go on for longer. And the only way I can sort of explain this with our families is that if you've ever had a big bonfire with a lot of rubbish, you get it all together, all that rubbish, you get the spark going, and you pretty much stand there and wait for all of that rubbish to burn up. Now, if someone gets upset at all the rubbish you've got, and they come along with a hose and put out your fire, what happens is that you get a whole lot of steam and a whole lot of soggy rubbish, and it takes a really long time for either that rubbish to be relit and burnt off properly, or it takes a couple of days for those embers to think, oh no, there's still some heat here, and then what can happen is the fire can come back. So I liken it to a fever, whereas if you start intervening with it and putting paracetamol in it and putting children in cold baths and taking their clothes off and keeping them cool, you're actually reducing the amount of heat in their system, which is actually needed to burn off the microbes that are within them. So no one wants to be uncomfortable with a fever, but people certainly want to be able to feel that they can allow that process to move through them in such a way that they feel better. Yes. Once you start, you then have to keep managing. So what I used to notice when I was nursing is that sometimes people would be ready for discharge that day, but we wouldn't let them go home until we'd taken their 4 o'clock temperatures. Because what you'll get is a spike and then everything's good, no problem. Then a spike and then everything's good. So watching for those normal peaks and highs and lows, particularly on different times of the day with that circadian rhythm. Yeah, so the peaks in the afternoon sometimes would be just that tail end of the fever that was leaving. So once you start medicating, you're actually on a different tangent than if you weren't medicating at all. And it sounds like she was more fearful than you. Yeah. So is it safe? Well, no, it's not that safe, actually. We have a huge amount of children which are admitted to hospital every single year with paracetamol poisoning. That's because their families use it because the babysitter's coming. They use it because they're going to church. They use it because they want to make sure that, the child isn't going to be too disruptive for whatever reason. And so it's being used in such a way because it's over the counter, it must be okay to use. Whereas in fact there's a lot of, chemical damage caused by overuse of these remedies. And so if you are going to use them, it has to be for a very, very particular reason. But in actual fact, with my family growing up, never, ever, ever once did we use it or did we have it in the house, which also meant that we had to resort to other things, homeopathics. Some more benefits of fever is that it actually helps with the immune response. It keeps things moving along. It's anti-inflammatory, which is the whole process of breast milk. It suppresses any more growth that's coming, to reduce it so that it's not as bad as what it could be. And it has ability to actually eat the cells that shouldn't be there. And sometimes with quite a serious bacteria or a virus, the fever helps it become less virulent. So a fever should be celebrated, not feared, but it should be managed in such a way that mostly someone, an adult, has to keep an eye on that child. And so when I talked before about notebooks or journals, if it was perhaps 2 parents sharing that child's care, that passing children over for the weekend or back for the week, having that communication book allows parents to know, this is where their tempers, this is what you've done, this is what we need to do, so that you don't have any changes in that care. And it also allows, that child to learn that wherever I am, I'm safe. I'm not going to go to this house and have this happen, and then go to grandma's house and have this happen. And then that tail end, that last part of the fever, which you've been talking about, really does clear completely, instead of maybe 2 or 3 days later, with not being, observed or managed, coming back again. So the basic nursing cares, which I will talk about a bit further, are these, and it's hydration, hydration, hydration. If nothing else, you're keeping your child hydrated. You know that when you talk to a health professional, whether it be your second opinion or your family member, you can say they're drinking well and their nappies are wet, so I'm confident that they're getting enough fluid. So that's the first thing to think about. Giving vitamin C is sodium ascorbate, and that's per body weight. Now, I'm not going to go into dosages because there's enough information that you can find out your dosage yourself, and I know that we've got a talk this afternoon on vitamin C, so you can ask all your questions then. But you do have to make sure that you don't get to the point that you've got something called bowel tolerance, which should be called bowel intolerance. Because you don't want a toddler who's unwell to then get diarrhea, to then have dehydration. And one of the things with having sodium ascorbate is that the body needs to be well hydrated prior to starting that sodium ascorbate regime. So when you get better at using sodium ascorbate, you get better at bringing it just up to the level prior to having the bowel intolerance, which usually is quite a noisy affair. Has anyone got to that point themselves? The bowel is noisy, it's making all these crazy sounds, and that's the point to either not have your next dose or have half the next dose, so that you keep that vitamin C level in the system without actually, getting that intolerance experience. So second opinion I've talked about, and I'm also going to talk briefly about convalescence. And convalescence is a lost art. It's something we used to know and we used to do, but now when we're sick we want to get straight back to work, straight back to school, without allowing that day there for rest and recuperation. So with hydration, sometimes people think, oh, well, I'll give them a big glass of water and get them to drink that big glass of water and that will be the tick, I've done the hydration. So breast milk, obviously that's easy to manage because they pop off and they pop on as they need it. And donated milk likewise. But you can actually just give like 1 ml at a time. 1 ml every 5 minutes at a time, even if it's just absorbing into the cheeks and through around the oral cavity. And that allows that child to then keep that water down. Because if you have 2, 3, 4 big sips at a time, sometimes just the pressure in the belly itself can actually just make the child vomit, which is not the experience you need them to have. If they're an older child, they might be interested in peppermint tea and chamomile tea, and again, just sips. And if you've got elderberry syrup, that's one of the things that you can just gently start on to help with the immune function. And of course, elderberry syrup is very, very high in vitamin C. Looking a bit more at vitamin C, the best and the easiest and the most beneficial way to get your vitamin C sources is from produce. Fresh organic produce. And so having that as a normal part of the child's diet means that if they're not well, you can make them a smoothie and have sips of their smoothie, perhaps watered down, and really teach them again that medical model of health, which is the first thing when you're not well, is that you use your food. And food should be across the board the most important supplement that you can give in the way of vitamin C, so that it doesn't become that child's medical model of health, is instantly, I need to get a pill or I need to get something to fix this. Even a homeopathic or a remedy. It's like food is first. So sodium ascorbate, lipospheric vitamin C and calcium ascorbate, they are all oral medications or supplements that you can use. And then if you are needing to have something as a topical application, the recommendation is that you use ascorbic acid. So for the measles, if you needed it, but more so when we talk about chickenpox this afternoon, having a teaspoon of the sodium ascorbate just into 100 ml of water into a little spray bottle, and you can use it as a spray on any type of wounds because it won't sting. Whereas if you put the sodium ascorbate in the bottle, it will sting. The second opinion can sometimes be your homeopathic remedy, but it could be other things as well. For families who've never used homeopathics, I recommend that they get the first 3 in their kit, the aconite, the belladonna, and the chamomilla. And that gives them, if they need to, the little feeling of, if I usually use paracetamol, then I've got something handy if I need it. Now, the aconite child is the child who lies on the couch, very, very pale, like a princess, not making a lot of noise, possibly didn't even know that they had a fever. The fever comes on very, very quickly, and they're kind of nervous and anxious, but they're not particularly complaining about it. You actually have to go to them and touch their forehead and think, oh, you're actually quite hot, even though you're pale. The belladonna child, they let you know really quickly. If they're in bed with you, they let you know really quickly. They thrash about, they're really, really hot, they're really restless, and they are capable of violence. So that means as you give them their remedy, they're going to go, I don't want it. So that's the belladonna. They've got a bright red face, and so they're very, very obvious. And the third one is your classic chamomilla, when you've got the child with one red cheek, possibly teething, and having that stress and wanting to be with an older person, another person, and carried, so that they relax and so that their immune system starts to function. So convalescence is about slowing everything down. When your child's not well, it's like, we're not going out today. we're going to do something different. It's not the end of the world if we don't go to playgroup, or if we don't go to the play date, or we don't end up at the family function. Having that child's health be paramount, especially when you're not choosing other types of models, is really important, because what happens when they sleep and they rest in their own rhythm is that their immune system actually produces a protein which helps control inflammation. So whether it's visible inflammation or whether it's an internal discomfort, it allows them the chance to get better and then get better again, so that they don't have something called a relapse. And then the last part of convalescence, which is hugely important with these 3 diseases today, is that you have the mineral salts. And the mineral salts can be taken for 2, 3, 4 months sometimes. So with a fractured leg, it's fractured, it's fixed, but actually there's 2 or 3 months there of bone work before it's strong again. With a bad chest complaint, all the symptoms have gone, but there's a weakness there in the lungs that needs to be supported in convalescence before that child is well again. So it's just ensuring that you've got several things for the beginning, for the middle, and also for the end of that disease state, so that you can feel confident that they have completed that process. So, measles, mumps and rubella. I picked the 3 of them mostly because they come as a vaccine, and I thought, well, in fact, people sort of see MMR as like a milestone and a dangerous vaccine for all the reasons that vaxxers told us it's a dangerous vaccine. But in actual fact, measles, mumps and rubella as diseases are not nearly as scary as people have made them out to be. They're really easy to catch, and that's probably why you should never ever go to Disneyland, because the minute you get there, you're touching things and coughing and sneezing and all the rest of it. And it can take quite a few days for those symptoms to manifest, in which case you might have infected other people. So that's common, that it travels quickly, and that's perfectly fine. That's just what measles does. How it presents is quite often as a cough which comes out of nowhere. So they didn't have a sniffle, there was no mucus when they went to bed, they were absolutely fine, and then there's this sort of really wet cough, not constricted at all, and that can be the first sign that something is a bit strange going on, especially when it comes on that suddenly. If you look inside the mouth in the first 24 to 48 hours of measles, you'll see in the side of the cheek something called the Koplik spots. And that's probably the best indicator of a diagnosis for measles, because once that period goes and it starts to manifest on the skin, you've got that, is it measles or isn't it? Whereas if you look quite early inside the cheek and you see your Koplik spots, that's what you want documented at the doctor. That's what you want taken a photograph of and put into your little journal, so that you can say it was most definitely measles because here's the Koplik spots. You will get some fever in the early stages of measles, and it could be that you don't do anything at all for that fever. You just know it's there, you might measure it, but actually it's probably just as important to not use the thermometer, to use this, and just have a sense of like, yeah, you're hot, but you're not boiling. And so that you can actually watch the child's behaviour, watch the child's symptoms without getting all panicky about what the number's telling you. Some people don't even have thermometers in their house because they're reassured by the fact that they have the experience to just be checking their child. As the fever progresses, you can actually get some of that heat which really does pick up, and instead of thinking I have to reduce it, just allow that child to sleep, and they'll sleep at the most inopportune moments, which is like, I remember when my son had measles, I got called up to school, and they said, your son is asleep on the floor. And I said, that's very unusual at 6. And when I got up to him, I said, I hear you were asleep on the floor. And he looked really hot. And I said, lift up your shirt. So he lifted up his shirt. I just wanted to see how hot he was. He was covered in a measles rash. Quickly, put your shirt down. So, sleep with a child who would not normally sleep, like long sleeps, 4 or 5 hour sleeps, and then up and a little bit of food, but their appetite's gone, and then back to sleep. So that worry about, oh no, they're sleeping too much. No, they're sleeping just right. They're burning off their fever, and they're going to come back at some point, and they'll let you know, usually with measles, because their appetite will improve. Across the trunk, there's this kind of flat macula. It's called a macular rash, and it's usually all over the trunk. And then what will happen, it'll move out to the arms and down to the limbs, and you'll have the appetite return. Now, people will say, it's okay in a country where there's lots of food if you get measles because, you'll be fine. And you will, because once that appetite returns, you will resume your normal health. But where we have fatalities with measles in other countries, it's not so much due to the measles virus, it's due to malnutrition. So if you have a child with this disease in their body and then they come out of it and they want to eat everything in sight, and there is no food, that is where you get your secondary complications. So that's the concern in a country where there's not enough food, is this the malnutrition, not the measles. Mr. Gates. So how do we treat measles? Well, we always start with the hydration. So sips. I'm your person. You're not well, I'm your person today. We're going to stay close together, and if I have to pass you on to another adult, they're going to know exactly what you need, and they're going to do the same thing, which is give you sips and sips, and we're going to talk to someone else if we're worried. Initially, start giving them the sodium ascorbate as per their body weight, and then I think particularly with vitamin A is that you need to find from a practitioner what is the right dose for your baby. And that's because vitamin A is a fat-soluble vitamin, so yes, you can get some toxicity. It's unlikely, though, but you just need to manage that dose so that you've not got something else to be worried about. Now, this little chap here, he's right in the middle of measles. He's got all over his face, and what will happen underneath those, underneath that rash that you can see, is that he'll also have another sort of very, very light pinkish rash, which is part of the fever underneath that rash on the skin. You can use echinacea as part of this very, very early part of the disease state because it's perfect for the immune system. And you can use any homeopathics as you need them, so pre, during and after, especially if you're concerned. Now, the cell salts are specific to measles and rash and fevers and things like that, but you need to have probably all 12 of them so that you can start picking out which ones it is that you need for whatever symptoms that you've got. One of the things that happens with measles is that they get something called photophobia. So when I had measles, I think I had, someone was talking about cut-out dolls, puzzles, and stay in bed. Now when children are unwell, they get given the iPad. Stay in bed, watch the telly, it's okay. But with measles, what happens is that light actually can give them headaches, it can be really distracting for them, and it can be quite uncomfortable to view anything, especially a light like this. So again, it might be the first time that they get some baby sunglasses, especially if they have to go out in the day, and making sure that they wear them at home and having the lights quite dim at home so that they're not surrounded by too much brightness. It's also important to avoid lots and lots of washing. If they have a bath every day, when they've got measles, maybe they have a bath every second day. Because what happens with their skin is they get their whole microbiome on their skin actively working as a sweating agent, as a healing agent, and it's important not to water down that pH too much just simply because you think that they need to be clean. What also can happen when children come through any sort of disease, and even an adult, is you get to that point of, I really feel like a shower. You really feel like getting clean, and that's probably the better time than actually popping the children in and out of the bath just because you think it's important. Now, there's something called the hearing law of cure. Have any of you heard of it? I'm sure you have. And it's about watching the body process going through the chest, or the trunk usually, out through the arms and out through the limbs. So it's quite fascinating when you've got the actual disease to not only take photos if you want to, but see how and confidently know that the body is actually clearing out that disease quite easily, and it's slowly progressing through the body. That's the hearing's law of cure in action. So mumps Mumps is another very easily transmitted disease, kissing, sneezing and all the rest of it. And we have at the moment a mumps outbreak in New Zealand, so don't come over, it's very dangerous. And what happens is when the vaccine wears off and children have become adults and gone off to college, and there's quite a bit of kissing and sneezing and sharing saliva, then you do have that possibility of, outbreaks happening, because the transmission is so quick as well, and also the vaccine, if they've had it as a child, may well have worn off by then. So it's infection for a little while beforehand and then for about 9 days afterwards. Very easily transmitted. This poor little chap's got a chipmunk face. Half of his side of his face is all swollen, and it's the parotid glands underneath that gives that swelling appearance. This can happen in about 30 to 40% of cases, which means there's a lot of mumps that you don't actually see any symptoms for. You can also get a mild respiratory tract infection without the swelling around the neck. So it could be that they have just a normal every respiratory problem, and then at some point there's titers taken and you realise that they've got mumps antibodies without having visibly seen the whole course of the disease. There's also some other symptoms with mumps, and that's pretty much usual fever, headaches and some sort of low-grade discomfort. So once again, you're into your hydration and get your second opinion. More than anything, you want some photos, because it is quite an interesting face to show that person a little bit later. Back into your sodium ascorbate, and some of the herbs that you can use for this is mullein, which is great for anything to do with ears, golden seal, a wonderful antimicrobial as well, and back to your echinacea. Again, for one of my children, when he got the mumps, the pain relief was a brand new warm hat. And every time his ears hurt or every time he was a little bit miserable, I just encouraged him to pull his hat down a little bit further. And he was fine with that. He didn't need pain relief, but he did need a little bit of reassurance that I could do something to help him to just keep a little bit warm and a little bit happier. Have any of you tried the salt in the sock treatment? So you put salt in not a very good sock, and you hold it up to the back of the ear, and so the salt will actually take the heat and the inflammation around the mastoid bone and draw it like an Epsom salt bath, but it's Epsom, or it's just salts, and they're dragged behind the ear so that the pain's reduced. Another nice thing, if you've got someone who's not ticklish, is to give them a really, really long and really gentle foot massage, because you're helping to not only get the immune system functioning at a glandular level, but you're also giving them that one-on-one, there's time around healing, there's time around spending time with mum or dad, and that consideration is allowing them to talk about any concerns they've got, especially, am I going to die? It's like, it's very unlikely. So that you've got that one-on-one time with your patient. There's a poultice here which I found on the internet where you find things, and again it's got mullein powder and chamomile powder, and I guess that's the flowers, and it's just put into a distilled water, turned into a paste, spread onto a cloth, and just applied again around the ear, but it can also be around underneath the glands. I think children, when you do something as well as you sit with them, they really like that. So whether you put on Rescue Remedy as a cream, they like that you're applying something and physically doing something. And although we might be, fine to give them a homeopathic remedy or something like that, they also like to have that tangible experience of something being put on them. That's my experience. Now, the biggest concern for mumps, or not getting mumps as a child, is that there might be, as an older person, past even adolescence, the risk of having orchitis. Now, I see there's not many men in the room today, and that's probably good, because if you had a look at the symptoms of orchitis, there'd probably be a little bit of wincing. So Orchitis presents as a very, very swollen, uncomfortable testicles, and because they're also glandular tissue, like you've got in the child, the parotid glands getting inflamed. In the adolescent or in the adult, you actually have the gonads. So in women, you've got ovarian pain, ovarian discomfort, really, really discomfort, pain, and then in the males, you've got all of these symptoms which come under orchitis. And so the concern is that if you had orchitis, you may become sterile. Now, for any mother, that's a concern for her child because that's her grandchildren. And so what you want to make sure of is that that person is treated and allowed to rest so that they can overcome the orchitis without necessarily having to have a lot of medication. Now, what the internet tells us is that there's absolutely no cure for viral orchitis, and the condition will go away on its own. And it says in the meantime you can use remedies at home. So although it sounds like a very, very uncomfortable and possibly dangerous part of mumps, it's actually very easy to manage and you don't necessarily have to have a lot of medication. I've just underlined the elevating part, which I have no idea how someone would do that, but I guess you just sit comfortably on a couch. But regardless of the source of the inflammation, so whether it's viral, whether it's a bacterial orchitis, full recovery can actually take several weeks. So mumps as a child is 4 or 5 days max. Mumps as an adult is 3 or 4 weeks off work, and it's not a very pleasant experience. I can tell from people who have told that to me. So how do we treat it? Well, we bring them flowers, of course. And we say that's very, very unfortunate. Now it says bed rest for 48 hours. Initially it said breastfeed for 48 hours. It's just a joke. But breast milk would actually be very, very useful if it was accessible. But initially I've put bed rest for 48 hours, feet elevated, knowing that no man in his right mind would ever sit for 2 days with their legs elevated. So I figured if I put 48 hours that I might get 12. Yeah? So wear firm, supportive undergarments to reduce the pull. Because if you're not sitting and you're walking around and you're doing all the things that you think you could do anyway because it's just a swollen testicle, what's going to happen is there's lots of pull, lots of drag, especially if you're in boxes, and all of that stretching on that inflamed tissue is what's going to be involved if there's going to be sterility in the future. So it's minimising that risk by resting and taking a remedy, perhaps like your apis if there's swelling, arnica if there's some bruising later, but I always remind people not to put any arnica cream in that area because it might be a little uncomfortable. And of course no laptops in the groin. Convalescence, I suppose, means different things to different people. And in this situation, it doesn't mean sit at home with your laptop and do your work. It means have a rest. Now, rubella. Rubella, as I said, there's not too much on rubella because rubella is such an innocuous disease. Most people who have it don't even know that they had it. There's very, very rare that there'll be a fever. Maybe, maybe not. And what can happen is rubella is missed completely, or it might be, was that measles? Oh, it only lasted a day, so it must have been German measles, which is our rubella. The symptoms arise as a rash in both children and adults. However, what I've missed out on the adult side is that there's also some joint pain. So that's probably the indicator as an adult, if you've got rubella, that there's difficulty and swollen joints, finger joints, toe joints, knee joints, which can make you think something's not quite right, even though there are no other symptoms. So the biggest concern with rubella is what it can do with in pregnancy for the baby under 3-4 months, and there can be some problems especially associated with ears and eyes and hearing and things like that, which of course is worrying for any pregnant woman. Now, before we had the MMR, women got rubella easily by the age of 10, 11, 12, 13, 14. So they never had to think about, when I have a family, do I need to be concerned about this disease? But one of the things that the vaccine did is it took out that natural ability for people to have protection, and so we're exposed once more to not only the risk of rubella, but we're also exposed in pregnancy to that fear. So being fearful when you're pregnant means that that baby is bathed in your fear, bathed in your adrenaline about something that might not even happen. I mean, we know rubella is just one concern in pregnancy and that there's lots and lots of others. So, hydration, you might not even notice that you need to use it. Getting a second opinion, especially if it's, do you think this might be measles, or do you think this might be chickenpox? No. Do you think this might be rubella? So getting a health practitioner, especially if you are pregnant, is important because there's a big conversation about whether or not that child may be affected. And I've had discussions with people about this regarding if that child was affected and there was some slight abnormality or deformity or not normal manifestation, that it might not be that termination is the only answer. So for some families it could be a really real thing, but for others it's like, we're not going to have a perfect baby, but we're going to have the baby we were meant to have. I know that some people who have had terminations have found out that there was actually nothing wrong with the baby. So that's a real dilemma and a real fearful thing, but I think it's also important that it's addressed. Back to our sodium ascorbate, and of course if you're not taking it as a supplement, you might be taking it through your normal food and produce. And one of the herbs which is useful with rubella because of the viral part is olive leaf, and again echinacea, and then back to our garlic and other remedies. So the last slide is, firstly, you need to get off the fence. Sitting on the fence is a really precarious place to be, and it's quite nerve-wracking. So you either decide you are going to vaccinate or you aren't going to vaccinate. Make up in your mind so that you know what you're going to do. And then once you know what you're going to do, it's educating yourself on the basics, managing your child's health so that you can overcome things like the fear. And the best thing is surrounding yourself with people like that are here today. Ensuring that you've got really, really good support and you've got a place to learn more. And so the last slide is me being a fireman. And I love this picture because what you don't realise is this was a training day. So we went along specifically to burn down this house. So that's why we're all in the front going, whoa, we had a great day. I'm the ones with my arm folded. But the reason I love this picture too is because it's like everyone's laughing about how tricked we've been to having an MMR to take us away from all this fear of getting these diseases. Whereas in fact, there's the only person who lit that place on fire is actually the big pharma, the CDC, the paediatricians, and all those gatekeepers that we trust, just like firefighters. But in actual fact, it's not true. Any questions?